Mackenzie?
Yes.
Hi, Mackenzie. Okay, and I'm so sorry I have to leave like right after my speech. So,
That's okay.
okay. All right. All right. Of course.
Really quickly. Sorry about
No, you're fine.
just have to. Okay, appreciate
All
it.
right. Good morning, everyone. I'm Arizona State Senator Annalise Ortiz. I have the honor of serving the people of Maryvale and South Glendale in Arizona's 24th Legislative District. We're gathered here today on the anniversary of what was Roe v. Wade because Democratic lawmakers and advocates are announcing that we have a plan to repeal over 50 Arizona laws that are still on our books that ban or restrict abortion care. In this past election, an overwhelming majority of Arizona voters made it clear they want abortion to be legal and accessible. This legislature, regardless of its makeup, has a mandate from voters who value freedom and don't want the government interfering in our private, personal healthcare decisions. We propose to repeal over 50 laws that anti-abortion politicians have put in place over the decades in this state. These bans and restrictions prevent Arizonans from being able to access critical health care, and it makes it more difficult for providers to provide that care. Abortion providers, advocates, and elected representatives believe that this state legislature should put the health and safety of Arizonans first. This is so critically important because the voters made their will known by passing Proposition 139. And now we have laws on the books that directly conflict with what voters wanted. Let me start that line over. Voters made it clear with Proposition 139 that they do not want politicians interfering with their healthcare decisions, yet we still have laws on the books that impact abortion access. It's time to respect the will of the voters and repeal those laws. We need to ensure that patients have the freedom they deserve to make these incredibly private decisions with their families and doctors. And now I want to pass it on to community member Mackenzie, who's going to share how she has been directly impacted by this issue.
Thank you so much. Good morning. My name is Mackenzie Darling, and I'm so grateful to be here today to recognize the introduction of this legislation. I'm here today to speak on behalf of the Arizona Proactive Reproductive Justice Alliance. Reproductive justice demands that everyone, regardless of sexuality, class, gender, race, or immigration status, has the right to bodily autonomy, the power to decide what does and does not happen to your own body. The repeal bills being introduced today are a crucial step to protecting this right for everyone. Each of us should be free to make decisions about our health and our future with dignity and respect. The Alliance envisions an Arizona where everyone has access to the care and resources they need to thrive. By removing the existing barriers to care and recognizing the right to access care for all Arizonans, including young people, people of color, immigrants, and people living in poverty, we are working towards reproductive justice for all. The passage of Proposition 139 shows that the majority of Arizona residents want to protect meaningful access to abortion care. They do not want the government interfering in making decisions for people or making abortion care harder to get. However, there's still over 50 abortion restrictions on the books that enforce barriers to care that people have to deal with every single day. I want to highlight some of these and share how people are affected with them. Abortion restrictions target abortion providers by forcing them to jump through medically unnecessary hoops just to provide care. These restrictions prevent providers from running clinics throughout the state, forcing people to travel hours, sometimes out of state, just to access care in the clinic closest to them. Insurance plans are still prohibited from offering abortion coverage, making it nearly impossible for people to afford care. When the cost of abortion care in our state is too high, people are forced to delay or forgo care they need simply because they cannot afford it. Currently, Arizona residents cannot get medication abortion care using telehealth or get prescriptions by the mail, even though the safety of medication abortion is widely recognized and over 26 states allow for telehealth abortion care. This forces people to take time off of work and secure childcare and transportation in order to obtain care in person. And our state imposes a waiting period, so people have to go to a clinic twice to get care. For rural Arizonans and hardworking people with busy schedules, these burdens are too much. These are just some of the bans and restrictions on abortion that are preventing Arizonans from being able to access critical health care. None of these restrictions are about health and safety. They're carefully designed by anti-abortion extremists to push abortion care out of reach. Abortion bans and restrictions fall hardest on people of color and immigrants seeking care. Black women, Indigenous women, and undocumented immigrant women are already more likely to lack access to health care, endure more dangerous pregnancies, and face over-policing in their communities. These repeal bills remove over 50 medically unnecessary barriers that have caused so much harm to people seeking care. The proposed bills target laws for repeal so that all Arizonans are free to make decisions about their own bodies and access to care in their own communities. By joining together to repeal these laws, we have the power to create a future where Arizonans are free to thrive, free from government interference in personal health care decisions, and free to access abortion care they need and deserve. Thank you.
Good morning, everyone. My name is Representative Sarah LaGoria. I represent Legislative District 5. We're out here today, and I thank you all for being here commemorating Roe v. Wade 52 years ago, and also reflecting and celebrating the historic one we had this year at the ballot when Arizonans enshrined abortion as a constitutional right in our state. But as you're hearing today, there's critical steps that we need to improve access to reproductive health care and abortion for all pregnant people in Arizona. You've heard about the 50 restrictive abortion laws that we're working to continue to appeal and how they undermine a pregnant person's ability to make private, informed decisions with their physicians. On top of these examples, I want to also just add to what pregnancy means. You might have been pregnant yourself, you might have a family member, a spouse, a daughter, a sister, someone you love and care about. Pregnancy is equally exciting and it's equally scary. What if something goes wrong? What if I get a bad scan? And now what people are having to run through their mind is, what if my legislator introduces something that hinders my care? What if the president orders a repeal and bans abortion in the country? The political and religious questions that should be going through a pregnant person's mind should not be there. A pregnant person should have access to health care. It is the most vital source of health care. It is life or death at times for people experiencing pregnancy. And what we are doing here today is really, we want to demonstrate that religion and politics should be free from these decisions. We should be uplifting care that Dr. Taylor provides to people that go to see her in her clinic. And we need to be recognizing that the United States, and Arizona in particular, while we've seen strides in the past 6 months, we are one of a few countries and a few states on a backward slide, stripping people's rights of reproductive care and abortion care. And that is what we're doing here today, is saying we will not continue this backward slide. We will fight for reproductive care, for abortion, for women's rights, and for the rights of all pregnant people. So we will work to repeal these restrictive abortion rights so that Dr. Taylor and others like her have the ability to provide comprehensive care, give timely access to this critical care, and also remove undue burdens on individuals seeking medical decisions, and so that those decisions are between a person and their physician only. Addressing these restrictions is essential to ensure that the constitutional right to reproductive health care in Arizona is fully realized and accessible to all. And I'll bring up Dr. Taylor of Desert Star.
Thank you, Representative Liguri. You are the representative that Desert Star Institute for Family Planning Clinics district is located. And thank you so much for being an advocate and champion for our clinic and other abortion providers. Thank you all for being here today. I'm Dr. Deshawn Taylor. I am the founder and primary provider at Desert Star Institute for Family Planning. It's an independent abortion clinic here in Arizona. It is the only other nonprofit abortion provider in the state. And we are here today because there's so much work to do to ensure that Arizonans have meaningful access to abortion, like they can actually get one if they need one, not that they just have the right on paper. Arizonans deserve quality reproductive health care, including abortion care, in our own communities. Anti-abortion politicians have enacted abortion restrictions every single year from the time I arrived in Arizona in 2009 until our Governor Katie Hobbs vetoed legislation in her first legislative session. So from 2009 to 2022, there was a new restriction added to the law books in Arizona, except for 1 year, leading to over 50 restrictions on abortion in this state. This is not the will of the people, obviously. This is self-interest. It's an agenda that not only strips healthcare away from vulnerable people, but it also favors tax breaks and corporate profits over thriving and healthy communities. I founded my independent abortion clinic in 2013. And this was during a time where Arizona was already losing significant access to abortion with all of the restrictions that were being passed, even though Roe v. Wade was still the law of the land, culminating in the 15-week ban that Arizonans have been living under since 2023. And so once voters approved Prop 139 and the governor certified the election, healthcare providers filed a lawsuit against the constitutionality of the 15-week ban. And so since that lawsuit is in progress, we providers who have the capacity, which Desert Star does, to provide abortion care beyond 15 weeks have started doing that. And I want you to understand how important this is for people. So just a week before the lawsuit was filed, I had a patient who came to the clinic thinking she was under 15 weeks pregnant, and she wasn't. And we had to turn her away. And then fast forward to just a week after the lawsuit was filed, we had a patient again who thought she was less than 15 weeks come to the clinic, and when she looked at the ultrasound, she screamed, "Oh my God!" because she was definitely further along than she expected, and she was definitely further along than 15 weeks. And she commenced to have a panic attack right there on the ultrasound table. And after calming her down and getting her to breathe, I let her know that she would not be turned away today, because now we can provide her an abortion beyond 15 weeks. But as other speakers have said, what still needs to happen is she has to come back at a future date. What still has to happen is we have to collect information from her to then report to the state. And what still has to happen is that she cannot get an abortion close to where she lives, because most abortion clinics are in Phoenix because of all the web of restrictions along with bans that force people from across the state into the Phoenix metro area. So what is really important for everyone to understand is Prop 139 was a victory, and we do not want to downplay that. But we have to roll up our sleeves for the work that still needs to be done. And that work needs to be done at the legislature. The people who make the laws that have restricted access to abortion in this state are the ones who need to take them off the books. They need to be repealed. And thank you to our champions, Senator thank you, Senator Annalise Ortiz and Representative Liguri, and also Representative Anna Abatia, who couldn't be with us today, who have signed on to support. We hope that there will be more, because repealing bans is not enough. We have to undo the web of restrictions along with the bans to provide meaningful access to essential care for Arizonans. Thank you so much.
I have one. I'm Stacy Barchinger. I'm with the Arizona Republic. I wonder if someone can address, you're talking about Republican lawmakers that you say seem more interested in putting these restrictions in place. What's your pitch to them to now repeal these 50 restrictions?
What'd you say?
Yeah.
I think part of that is what Senator Ortiz mentioned of this mandate. Across the country, voters enshrined abortion into their constitutions, not just in Arizona overwhelmingly, but other states. So if we're talking about what the mandate is from the voters this past election, it most clearly resonates that this is important. And part of that is, as Dr. Taylor said, not just repealing the restrictions on abortion, but understanding that there is so many other restrictions that prohibit and restrict women and pregnant people from getting the care that they need. And so I think that that further helps us develop those conversations. Looking back, a lot of these new legislators might not know what bills have been put on 10 years ago. And so we're using that as a way to continue the conversation, to educate and let them know that this is what voters want and this is what's right for all pregnancies in Arizona to have the best health care they can receive without restrictions.
Representative Lagori, can you talk a little bit about your strategy? Are you guys going to have to introduce 50 different bills, or is it like one bill that will kind of sweeping address them all?
A great question, thank you. There is a number of legislators here introducing different forms of repeals. The work that Dr. Starr and the Reproductive Alliance have done, it's not necessarily one omnibus bill. It's broken off into different sections. So I think we'll have 4 in total. But I would say that you could see 4 to maybe 10 different ways that we're going at it to repeal these restrictive abortion laws.
If you had to choose just a few that might get through, are there some that are kind of higher priorities than others, the waiting period or the telehealth?
I think that both of those are important examples. I don't necessarily know, and this is where I lean on the providers too. I don't know if there's priorities of these. These are all very important because they're all very harmful to the access of care. So the telehealth, I think, is a priority just for the way that it's restrictive for people that don't have access to clinics. But we're working at all of them full force.
I can answer that.
Yet?
Oh, yeah. Would you like to chime in there?
She's asking
Oh,
are
I'm
they
sorry.
introduced
I
yet?
just asked, are they introduced yet, or that's coming in the?
Yeah, a few are. The ones we are working on are not, I would say, by the end of this week. You wanted to go back to that?
Yeah, so the Northern Arizona has had no access to abortion for at least a decade. So imagine how helpful being able to do a telehealth consultation to get the information you need about to decide whether you need an abortion or not. Even not having a clinic where you are, at least now you know that you have a provider that you're going to go to, and you're going to show up and get the care you need. You can make the arrangement that you need to make. But what's happening now is someone has to travel all the way down to Phoenix, have a consultation, and then figure out the logistics now that they know how much time they have, and then go back home and come back. And so I want to share that our state legislature some years ago preemptively banned telemedicine abortion before it was something that we were even considering doing here in Arizona, because some good information was coming out of clinics in the Midwest about how useful telehealth was to help people, specifically for medication abortion. And we've seen how that proliferated during the COVID pandemic, and how people have now 60% of people do abortion pill because it's more accessible to them. Here in Arizona, it's a physician-only state. Advanced practice clinicians cannot even hand out mifepristone for people to take. And so that really hinders people's access.
Thank you. Any other questions? Thank you all for being here.
Thank you.